Hey everyone, welcome to Only for Teens. We're going to be continuing the previous program on ADHD. Again, we have Dr. Netta on the program. Thank you once again for being here.
Sure. Thank you for having me again.
So last time on part 1 of this program, we talked about not just ADHD, we talked about the different kinds, symptoms and things like that. And we left it on parents and what they can do. So out of curiosity, is it more common for parents to notice that their teen might have ADHD, or have you ever had a case where the teen themselves might think that they have it?
Well, as we talked about before, it's very in vogue now to have ADHD. So a teen might come in and say, you know what, I'm having trouble focusing, concentrating, homework is a real struggle for me. Or the parents might come in and say, you know what, we're having serious issues at home. I can't get my son to school in the morning, or my child is constantly getting in trouble at school, or we're fighting so much because my daughter doesn't listen to me. And we can start to, from there, work on possibilities of what it could be.
So when a parent or a teen or whenever anyone comes into your office saying that they think their child might have ADHD, what's the first thing you do as a psychologist? Apart from, you said before that you looked at the different settings, right? Mm-hmm. And you interviewed different people. Is there anything else to that process or anything you'd like to add?
Well, we have to first take a comprehensive history of symptoms. Mm-hmm. When they started, what kind of symptoms they're exhibiting, where they're exhibiting those symptoms. Are there certain times of day, certain days versus weekends? Are there certain areas where this happens, at home, at grandma's house, mm-hmm. at school, at soccer or football after school, all of the above? So once we get a comprehensive history of the symptoms, then we assess the severity. For example, somebody who's having a little bit of trouble concentrating, let's say they're not really listening to you right now. Mm-hmm. Kind of not, what were you asking me? I wasn't really concentrating. Right. That's not a severe impact, right? Mm-hmm. But somebody who's really losing focus and can't remember what they learned at school, or can't focus on the math assignment on the blackboard, or doesn't even know what day it is and keeps on forgetting what day it is, that's somebody who's having severe impairment. Somebody who constantly forgets their backpack at school, or forgets to take their homework from their school back home, or forgets to bring their lunchbox to school.
Those are forgetting things like those simple things?
Sure, those are severe impairments. Somebody who's having difficulty getting along with friends. Like we talked about before, ADHD has a social aspect. Kids with ADHD sometimes are too hyper and their friends don't want to be around them. Mm-hmm. Or sometimes they're too much in their space. They're constantly touching them and, hey, can I see your iPad? And it's too much in your space. So people don't really want to be around them sometimes unless they're properly treated. So we assess the severity. Does it have a severe impact on the child's functioning, on the teen's functioning? After we get to that point that we have more of a concrete idea of what the symptoms are, then I always like to send out reports for the teacher to complete, or for the coach to complete, or for the teacher and the coach to complete. The more information, the better. These reports come back to me about the day's functioning, the week's functioning, and that way I can see what's happening outside of the home. And not just from the teenager themselves, but also from the teenager's coach directly to me. So once I get a more complete picture, I can understand as to whether or not there's a possible diagnosis of ADHD, or maybe something else altogether. So it's quite a complex process, but once we gather information from the different sources, then we can diagnose.
And does it happen a lot that they might come in thinking it's ADHD, and then you do all that, and then you find out it might be something else?
Of course. People think that they have ADHD because they have difficulty sleeping, or because they're very, very active. Sometimes we see that it's actually a thyroid condition. It's not even anything psychological. It's something physical, that their thyroid here is overactive, and it's allowing them to become too hyper, to be very, very thin, to not be able to focus so much. Depression and anxiety are two other conditions which people often mistake for ADHD. And so it's important that a trained clinician assess you and decide whether it's depression, anxiety, ADHD, or something else altogether.
And so after you've done that whole process and you say, well, it must be ADHD or it is ADHD, what happens after that in terms of medication or in treatment?
Well, medication is a very individual decision. It's a parenting decision, really, right? Your parents have to decide if they want to medicate. Some parents come in and they want nothing to do with medication. Some parents want everything to do with medication. So once you decide on whether or not you want to medicate or not, you have to go to, and I always recommend going to a trained psychiatrist that medicates for ADHD. The reason being is that there are all kinds of medications you can take for ADHD, and the dosages have to be adjusted ever so slightly for it to work or not to work. If you take just too little of a medication, it does nothing for you.
Right.
But if you take the right amount, it does a lot for you. And similarly, if you take too much, it causes other side effects that are not desirable. Like sometimes people take too many medications, too much of a dose, and then they have a really hard time falling asleep, or they might have decreased appetite, or they might feel really jittery, or have feeling like their heart's pumping really fast.
Right.
So it's really important to go to a psychiatrist that knows ADHD, that treats ADHD in teens, and that knows what they're doing.
And taking the wrong dosage could be potentially dangerous as well.
Absolutely, absolutely. Like we talked about earlier, it could cause all kinds of issues with your heart and other symptoms that nobody wants to deal with.
And you said that like just the right amount of dosage for the medication. Does that stay kind of constant throughout the person's life, or can that change?
Nope, because what happens? You grow, right? You grow, you weigh more, you need more meds, and the meds have to be adjusted. So they constantly have to be adjusted. The other piece of it is that therapy is also extremely important in treating ADHD. Why? Because like we talked about, some people don't want to have anything to do with medication. And also the research shows that therapy plus meds is the most successful for treating ADHD. So you can do just meds and you'll have some success, and you can do some therapy and you'll have some success, but if you do therapy and meds together, you have the most success.
And you said some parents want nothing to do with medication. Does that happen a lot, or like very frequently?
Yes, especially in younger children and in teenagers like you guys, because teenagers are growing up, they're becoming, their bodies are changing, their brains are developing, and some parents want to have a very, very healthy environment for their children, and they fear that giving meds might somehow harm the children. But in fact, what we see is the kids that are truly ADHD, that take meds, have better success in life, better success in school, are less likely to use or abuse drugs in the future, have lower incidence of teen pregnancy, have a lower incidence of incarceration. So in a way, taking meds as children and adults, when you're actually really an ADHD child or a teenager, helps you function later in life optimally and better and in a more healthy way.
And just like out of curiosity, would the meds help because ADHD being a disorder that involves the brain? Is that it works together with that to help the teen in being better?
Yes. Like we talked about, ADHD is a disorder of the brain, and the primary neurotransmitters in the brain that are impacted are norepinephrine and dopamine. So the meds that we use for ADHD, they all impact your brain's capacity to produce and absorb norepinephrine and dopamine.
So it's like is it a chemical imbalance in the brain?
It is.
And after a teen has been diagnosed with ADHD, and after them taking medication or going to therapy or a mixture of the both, do you believe they can live a completely normal life?
Absolutely, but then again, what's normal, right? I want to point out first of all that a very important point. ADHD is a disorder and it's a condition, but it's lifelong, but it's treatable. Okay, so I want whoever has ADHD or thinks they have ADHD to remain very, very hopeful. Okay. Secondly, we know so much about this disorder now that there's so many resources out there for therapy, for medication, for parenting strategies for parents who have children or adolescents that are ADHD, and even for adults who realize as adults that wait a minute, I'm ADHD. So we have so much information and resources and education out there. It's a really well researched condition, and I want anybody who's watching this to realize that if you think you have it, or if you do have it, you can treat it and life will be manageable, and you will have better coping skills as you grow and evolve to be able to work within yourself in a better way and to feel more secure and more manageable.
Oh,
So.
Thank you so much, Dr. Shiket, for being on this program. I really appreciate it.
Thank you, and again, thank you for having me.
I hope you guys learned something new about ADHD. This has been our program on ADHD, and have a great day, guys.